depending on who you ask, you're going to get different answers about the appropriate role of government. So typically we think about government as performing a couple of different functions or potentially forming a couple of different functions. Securing private property rights as being paramount among those. Also doing things like providing public goods. So people tend to think about things like defense as falling into that category. And also to protecting its citizens from internal and external threats. So to the extent that people feel that that is an appropriate function of government, then something like COVID-19 could certainly apply within the relevant scale and scope of what government should be intervening or what government should be doing. So there are a lot of potential things that we can talk about with respect to this crisis. And I think it's important to start off from the beginning by saying there's need for very, very strong humility right now for everybody who is talking about potential solutions to this problem, to what we should be doing, we being government, we being citizens, and what people should or should not be doing. As an economist, I think that there are certain things that government could do in order to help this situation, perhaps substantially, and a lot of these do not require any type of forceful intervention. In fact, they require the exact opposite. So government effectively getting out of the way. So things like reducing or eliminating tariffs on the goods and services needed to get us through the pandemic. So for example, the company who manufactures Purell tried to file to get the tariffs on their products waived. Didn't happen. Things like that. Ending the monopoly on disease testing and manufacture. So throughout all of this, we've seen serious issues with the rollout of testing in the United States. A lot of that falls directly at the feet of the FDA, letting private companies develop, deploy, and interpret the results of these tests could mean testing more people faster and open up different avenues for policy options. I think a really important one is seriously considering eliminating certificate of need laws, which up until this point have prevented the addition of hospital beds in existing hospitals, prevented the construction of new hospitals or new medical facilities, which now, as we see, is presenting a real problem when hospitals are looking at being overwhelmed. Ending price gouging laws to allow price signals to appropriately allocate resources to their highest valued use, and to the extent that it's possible, allowing people to open themselves up to economic activity while still maintaining an appropriate level of distance and appropriate level of safety, and allowing different places with different needs to explore options that are best suited to their specific circumstances, as opposed to treating the entirety of the United States like one homogeneous population where one homogeneous policy is appropriate. When talking about this, those who are suggesting these intensive interventions, locking down cities, closing off borders to people from particular locations, the impetus is really on those individuals to illustrate, and I think they should be doing it ex ante, that these are going to have a positive benefit. Now, it's interesting because we can make different kinds of errors with respect to pretty much any or lots of decisions, but with COVID-19 and policies, if people or politicians and policymakers don't react strongly enough, so let's say that they don't engage in intense enough policies and more people than we would say maybe necessary, or more people than more people that may not die or may get really sick do, that results in negative consequences for them personally. However, if people overestimate and overreact, then on the back end, for those individuals, the consequences do not appear to be as severe, because they can always say, oh, well, it's better to have overreacted than underreacted. The issue that I see, and I think that others have pointed out, is that the policies that people are promoting right now are not costless policies. They have a very real, and I'm not just talking monetary cost, they have a very real human cost to them as well. And these human costs must also be considered. When making decisions specifically with something like this when we're making decisions with really, frankly, bad data and incomplete data. We should be careful before going off in a very radical direction, as opposed to trying to figure out, okay, what is the data telling us? What can the data not tell us? And then where do we go from here? So there are a lot of potential things to talk about. I think here in this context, again, knowledge problems and incentive problems are remarkably important. So do those in charge possess the knowledge necessary in order to be able to appropriately craft, deploy, and then subsequently withdraw, in this case, an intervention? And the answer to that question is likely no. So as we've seen, even people who are experts in this field, so epidemiologists, healthcare experts, there's been widespread disagreement in terms of how the virus will spread, when it will spread, at what point we'll hit peak infection rates, and things like that. And so when you are suddenly now thrusting non-experts, so primarily political officials, into this arena, frankly, I think it's unfair to expect them to be able to acquire and then integrate this knowledge into policy plans in something that they were not trained in. In terms of incentive alignments, I think we're already seeing, particularly with the new relief package, most of it is not going to individual Americans or even small businesses. A lot of this is going to larger businesses with a political interest or political ties to either the current administration or other individuals who are in the US Congress. And so I think that there's a real necessity here to question both the knowledge that individuals possess, as well as the incentives that those who are implementing these policies are facing when they do. Stimulus package, while it might sound appealing, is not likely to have any kind of long-term relief. So you can look at this in a few different contexts. One is looking at the total amount of the package versus how much of it is going to, again, larger corporations that may or may not have anything to do with the crisis at hand, but have friends or people who are friendly to them in political office. Another way of looking at that is thinking, well, this is all based on income, not necessarily who's keeping their job, who's losing their job. And so it's ultimately a blunt instrument that's likely poorly targeted, and something that is adding tons of money to our national debt. And on a per family basis, you're talking about tens of thousands of dollars for a family of four that at some point will have to be repaid. And this is yet another example of something that appears to be a short-term solution, but without an appreciation for the potential long-term consequences. One thing I see that people are frequently bringing up is that when someone suggests that shutting down the economy might not be an appropriate policy solution, they're often just pilloried by the people who feel that they are putting the economy, or typically they frame it as you're putting money or profits over people. And I just want to stress that that is really not the message that I hope people are taking from those of us who are advocating that we take a very serious look at the consequences of the policies that are currently being implemented, particularly with respect to shutting down, again, entire segments of the economy. Because economic cost and human cost are intertwined. We can't separate those two. And so it's not as though choosing to shut down the economy is choosing people, and then looking at the economy is to ignore the cost of allowing people, say, in close contact and spreading the disease. That's not what this is. But when we do research these types of things as economists, we know that when there are recessions, when people lose their jobs, there are consequences that come along with that. So things like increased rates of suicide, of depression, of opioid use, of drug overdoses, things like domestic violence, which we're already seeing reports of spikes in domestic violence. I think in Paris, it's something up like 40% in the time that they've started um, their intensive shelter in place orders. Things like child abuse. There's all kinds of stuff that is a very real human consequence. But again, this is stuff that is not necessarily easy to see right away, but things that nevertheless can and do have very real, very serious human consequences. And so, for those of us who are concerned, and this is not at all to even speak to the civil liberties issues, which I think are important, and if we see and have seen time and time again, in the presence of crises, civil liberties do suffer. And there's, again, this false dichotomy that somehow we have to trade off liberty for safety. And that's not the case. And if at anything, talking about those things is important, it's important at times like now, where it's easy to let these things go. It's easy for us to choose to feel safe in the short term, as opposed to thinking about those seen consequences as well as those unseen consequences. So all of those things that I talked about, and then frankly, a lot of things that we can't know yet, because one of the things that we learn as economists is that some things are long and variable. There are system effects or changes that occur as the result of intervention that we can't anticipate at the outset. And those things can and do have very real and far-reaching consequences.